Hi, my name is Katie Lucas, and we're going to go over our stages of swallowing. Here we have a diagram showcasing our 4 stages of swallowing. We have our oral prep, oral transit, pharyngeal, and then esophageal. So for a complete overview, we're going to have our medical diagram on top, and then we're going to have a simpler version on bottom. Our 2 tubes, we have our horizontal, which is our oral cavity, and then our vertical, which is our pharynx. This is going to work as a valve system to direct food and create pressure. We have our lips to create an interior seal, our oral tongue to push the bolus back, velopharyngeal region to close the nasal passageway, the larynx to close the airway, the tongue base and the pharyngeal walls to generate pressure, and then the cricopharyngeal region, which contains our upper esophageal sphincter, or our UES, to open for bolus entry. Starting with stage 1, oral prep. In this stage, food is manipulated and chewed to prepare it for swallowing. A couple of processes are going to happen simultaneously. The food is going to enter the mouth and it's going to be sealed in by the lips, creating a labial seal, while breathing continues through the nose. The tongue and the soft palate will work together to keep food in the oral cavity. Mastication or chewing begins using the jaw and tongue muscles. The tongue seals the food along the alveolar ridge to keep it in the mouth. The food is compressed against the hard palate by the tongue. The tongue will move the food onto the grinding surfaces of the teeth, mixing it with saliva, and that saliva will release from the salivary glands to form a bolus for swallowing. The buccal muscles contract to prevent food from entering the space between the gum and the cheeks, also called the lateral sulci. So here in this image, you can see that there is our bolus right here on top of our tongue. This bolus is pushing up against the alveolar ridge, and it's going to go back onto the hard palate. And it's going to be mixing with saliva this whole time, released from our salivary glands. Stage 2 begins when the tongue moves the bolus backwards. The midline of the tongue sequentially lifts from front to back, pushing the bolus against the hard palate in a rolling motion, and the sides of the tip of the tongue will stay in contact with the alveolar ridge. Central groove will form, creating a chute for the bolus to move backwards onto, and this ends when the bolus passes the anterior falcal arches, which triggers a pharyngeal stage. Viscosity will play a role in the tongue pressure and muscle activity to push that bolus back. This whole duration of the oral phase will last between a second to a second and a half, depending on the viscosity. Stage 3, or the pharyngeal swallow. As the tongue moves the bolus back, the sensory receptors in the tongue and the oropharynx detect it and send signals to the brain. For sensory processing, our nucleus tractus solitarius in the medulla recognizes the sensory input and signals that food is coming. For a motor response, the nucleus ambiguus, or the NA, is activated via the vagus nerve, which starts the swallowing motor pattern. Cranial nerves involved for sensory input and motor output is both going to be the glossopharyngeal and the vagus. For sensory, it's going to detect the bolus, and for the motor, it's going to control the swallow reflex. Higher brain areas in the cortex will contribute to this eating process. And here we have a diagram showcasing that our cranial nerves connecting to our structures. To trigger the pharyngeal swallow, the bolus head is going to pass our anterior falcal arches, also known as a trigger point. The food, liquid, or saliva has to have a couple conditions for it to work. It has to be in the mouth, and the substance has to be present, and then there has to be conscious intent to swallow it. Swallowing has both voluntary and involuntary components, which we'll get into. So, first, our soft palate is going to lift, closing the nasal cavity, increasing pressure in the pharynx. This is when our breathing is going to pause completely. The hyoid and the larynx elevate and move forward to help close the airway and open the upper esophageal sphincter. The larynx is going to close at 3 levels: the true vocal folds, false vocal folds, and the epiglottis. And that epiglottis is going to fold over the airway or the trachea as the hyoid and larynx elevate, providing that top layer of protection against aspiration or choking. After the swallow triggers, the tongue base forms a ramp to direct food into the pharynx, and the tongue retracts and the pharyngeal wall contracts, bringing them together. And this will increase pharyngeal pressure to push the bolus downward into the upper esophageal sphincter. This process is called peristaltis, is when the pharyngeal walls contract downward into the UES. So there's a couple of simultaneous actions happening during swallowing. We have our esophageal sphincter opening and the airway closes. And then for our UES opening, it's a complex step-by-step process where the UES muscle relaxes, the larynx moves up and forward, pulling the UES open, the bolus pressure further widens the opening, and then as the larynx lowers and the bolus passes, the UES closes again, triggering our esophageal phase, which lasts about 8 to 20 seconds, which is where we have from our UES entry to our LES passage. This is when the bolus movement is caused by the peristaltic waves. pushing the bolus downward. And here we have an overall GIF showing our complete process of swallowing from start to finish.